Hello, my name is Tanja Riley, and I will be talking about the role and responsibility of community and public health. This presentation is briefly about community and public health services, funding, and communications within the organizations. The role of community and public health is to assure healthy conditions and population, not focusing as individual. The realization that both science and communication are essential to promoting and protecting the health of the public was a major milestone in the emerging discipline of public health communication. Public health system as community-based organizational network that include the full complement of public and private organizations that contribute to the delivery of public health services for a given population, including governmental, public health agencies, as well as private and voluntary entities. Organization and government is needed to have a public health system that can bring services well deserved for the citizens of a country. Role of community and public health. Public health agencies are creating and designed to have core functions as appropriated their funds, regulation of persons and business, tort litigation and deregulation. Public health faced in challenges like possible pandemic influenza, agents such as anthrax or smallpox, and even obesity epidemic. This organization highlights the need for policymakers to adopt epidemic control measures that openly balance ethical values. Public health regulation involves potential trade-offs as well as synergies between public goods and private interest. Public health states create public health agencies with a mission and core functions, assign funds, grant their power, and limit their actions. The organizational structure within the public health. Federal agencies, state, tribal, local, and territorial health department. Government agencies other than public health, clinical care delivery system, community-based organizations, educational institutions, private non-profit associations, private industry, and media. The government should protect its citizens for diseases. It is important to have sanitary conditions. Public health projects have dramatically improved global status. Public health is us. What we as a society do to collectively assure the conditions in which people can be healthy. This requires the continuing and emerging threats to the health of public be successfully countered. These threats include immediate crises such as AIDS, epidemic, enduring problems such as injuries and chronic illness, and impending crises foreshadowed by such a development as the toxic byproducts of a modern economy. The CDC awards nearly 85% of its budget through grants and contracts to help accomplish its mission, to promote health and quality of life by preventing and controlling disease, injury, and disability. Grants assist other health-related and research organizations that contribute to CDC missions through health information dissemination, preparedness, prevention, research, and surveillance. Each year, the CDC awards approximately $7 billion and over 14,000 separate grant and contract actions. Because CDC grants are intended to support a public purpose, they provided grants to organizations whose work affects many people. Public health communication focuses more on improving the health of communities and populations than on deconstructing the underlying mechanism of communications. When the attacks of September 11, 2001, United States realized the important point in public health. The citizens of United States realized the health and security of this nation depend on a robust public system. One of the most important revelations was the role of strategic, timely, and effective communication in public health. Public health communication draws from numerous disciplines, including mass and speech communication, health education, marketing journalism, public relations, psychology, informatics, and epidemiology. Health can be affected by the social, political, environmental, and behavioral factors which people live. Multi-level of communication strategies and interventions can be done in a major way of ecological perspective. Messages can be communicated as tailored messages as an individually level, targeted as a group level. Although communication initiatives often target for change those behaviors that contribute directly to morbidity and mortality. Public health communication also targets social, physical, and environmental changes that can influence health outcomes. And this slide is for the reference that I use on this PowerPoint presentation. I hope you enjoy. Have a good day.